Hello everyone, this is Dr. David and I'm the co-founder too of Building Strength Webinars, and I will be your host today along with Sherry Platt. And before Dr. Joe gets on, usually there are a couple of things he needs to do to log on, and that only happens when I log on first. So while we're waiting for him, I'll be trying to entertain you. For those of you who are joining us for the first time, I'm going to say a few things about us, and obviously if you're watching this afterwards, you can always skip this introduction to go straight into Dr. Joe's presentation. He should be the third chapter. Yes, I accept Dr. Annibali, and I accept Sherry as well, so they're coming on. It looks like things are working, and let's just say a few things about us. That's Sherry Platt. You're going to see her in a minute. And our goal with these webinars, by the way, a special welcome to the members, especially. Remember, as the members who keep us doing what we're doing and helping us and support us in the things that we're doing. So we're very, very grateful for you all. And we shall be saying a few things about membership as we go along. Our goal is to give people as complete a picture as is possible. And obviously that's a tall order, but we can try. And you cannot have a complete picture of health without looking at the spiritual and the mental as well as the physical. And of course, Dr. Annibali will be addressing some of these things as well. And we have had a lot of help where that is concerned, and we are so grateful for those who have worked with us as we have gone along in this quest. Okay, and we will be talking about some of the promotional items that we have. This is primarily an educational webinar, but obviously you cannot really get the full gist of brain health, certainly not brain health, in just 1 hour. You've got to, it has to be an ongoing learning process, and we've put together some of the best collections of teachings and handouts and educational resources that can help you. Each of these webinars is actually an hour and a half long, so we really try to cover as much as we possibly can. Our vision is, as many of you know, to be that trusted resource. I mean, think about this. Many people don't really know how to search for information online. I mean, take Aunt Sue, for instance. She may be in her 70s, and she does not know how to search the internet, but she may be concerned about her husband's brain health. He might be forgetting her name. She may be concerned about her grandchildren, whether or not they're doing well at school, or maybe they have infections, they're prone to infections. We want to be that central resource where people who can go to, and really we're getting CDs and DVDs available as well. And we might have one of today's presentation if Dr. Joe allows us to. And we can provide those resources for people who don't know how to get the best information out there. And so really our goal is twofold. Our mission is twofold. Now our goal is to be the trusted resource, but our mission, how to get there, is twofold. One is to help people better understand how their minds and their bodies work, and today's presentation will be a perfect example of that. And number two, once people understand how things work, they will better be able to understand how to get the best resources out there, how to get the best sources of information out there, how to ask their doctors the best questions, how to even find the right doctor who can guide them in their pursuit of wellness and health. And so that's our goal, and we thank you for joining us in this quest to do that. And speaking about finding the right doctor for their problems, let me show you this. This is a picture you're looking at of Karen and her mother, her deceased mother. I hate to use that term, but anyway, here's what she wrote to me when she saw that Dr. Annibali was coming on for this webinar. She said, "Hello, Dr. David. I just wanted to let you know that I know Dr. Annibali personally. He is going to be on your November 22nd webinar, I think. Yeah, you're right. I took my mother to see him in Reston, Virginia, and he heads up Dr. Aman's clinic at that location. He happens to be educated in my area, University of Pennsylvania, and Hershey Medical, so I am well aware of his credentials. He was the best. He was sweet and kind to my mother. He was thorough in his follow-up with us. I am looking forward to hearing his webinar. I have read all of Dr. Aman's books before I took my mother to the clinic. I am a researcher and technical medical writer / reporter by profession, and I trust no one in the field until I check them out. Smart woman. Dr. Amen has done so much for the world of brain trauma. I wish I could help everyone that I come into contact with, but that has unfortunately experienced a brain trauma. I give them his websites and his information to everyone that I meet, and I know his approach can help. Unfortunately, the day after Dr. Annibali gave us his SPECT scan results and we talked on the phone with his suggestions, my mother died from the flu in her sleep. I sometimes think it was a good thing because it would have been a difficult but positive healing plan for her. But maybe she would not have been up to it, even though my holistic help for her had her as strong as a bull. She and my father are together now in heaven. They are dancing to the polka and bowling together. I try to help others in her name. So I hope many people listen to his webinar and are positively helped by it. I am off to get a tissue. Take care, Karen. Yes, I do. That's such a touching letter, and yeah, we hope a lot of people will be blessed by this. We've had over 2,000 people register for this webinar, so it's exciting. We're looking forward to this. Remember, this is not about treatments. This is certainly not for you to go run off and treat yourself. This is hopefully to guide you in the right direction. Please get back with your healthcare provider with some suggestions, okay? All right, I'm going to hand this over to Sherry. Dr. Annibali, thank you so much for taking the time to do this.
Hi, David. Okay, yes, I would love to introduce Dr. Annibali to you. Dr. Joseph Annibali graduated magna cum laude from the University of Pennsylvania, where he was a senatorial scholar and from which he received an honors award in the studies of biological chemistry. While completing his residency in psychiatry, also at the Pennsylvania State University, Dr. Annibali was named a Rock Slester, I'm not sure if I said that correctly, Scholar in Psychiatry by the American Medical Association. He was also named a John Frederick Steinman Fellow during his residency training. During this time, Dr. Annibali published work on Tourette's syndrome.
Okay, well, great to be here. Thank you, David. Thank you, Sherry. Appreciate all the help in getting me live. I am chief psychiatrist of one of the 4 Amen clinics. My clinic is in Reston, Virginia, and we serve the whole East Coast and, in fact, other parts of the U.S. and other parts of the world. So we see a lot of people from all over the United States, from Europe, from Asia, from Africa, South America. So that in and of itself is very exciting. Today we're going to talk about ADD, myths and misconceptions, and hopefully some mastery. Let's go to the first slide. So here's some myths and misconceptions. ADD is a flavor of the month, a fad. No, that's not the case. ADD is overdiagnosed. Every child who acts up gets put on Ritalin. I wouldn't agree with that. Only a disorder of hyperactive boys. No, not the case. Only a minor problem. People make too much of a fuss. And actually, it's a real significant problem that can really affect people. ADD is an American invention. No, I don't think that's the case either. There's good data to suggest that people in most societies have ADD at about the same rate. Let's go to the next slide. Here's one. Bad parents or bad teachers cause ADD. This is very common, and we often find that people coming to us feel very bad about their parenting abilities, and we find that the students, the kids, when their parents bring them, feel bad about themselves, as if they're lazy, they're not trying, and so forth. Other myths and misconceptions: stimulant medication is dangerous and highly addictive. No, it's not. Well, when used properly, it is not highly addictive. We've been using stimulant medication for a long time in medicine. Medication alone is the best treatment. No, it's not. It can be a very powerful component of the treatment, but it is not the full treatment. Another myth: people should just try harder. People with ADD should just try harder. Everybody makes excuses for them and coddles them. And in my experience, and I think the experience of many of my colleagues, just the opposite is true, that often people with ADD end up trying much harder than somebody without ADD. They end up with less to show for it, and they often are hearing, oh, if you'd only work up to your potential, and so forth. Everybody outgrows ADD by 12 or 13. That's not the case. It can evolve somewhat. The facts, ADD has been described in the medical literature for over 100 years. ADD affects at least 5 to 10% of the population, but fewer than half of those, probably far fewer, receive treatment. Many people with ADD are not hyperactive. We tend to think sometimes that ADD means being unable to sit still in the chair, and that's one subtype of ADD, but it's not the whole spectrum of ADD. Another important fact, the harder many people with ADD try, the worse things get for them. And I was alluding to that earlier, because often they try very hard, and we see on brain imaging that when they are working hard, when they're using their brain to work hard, the part of their brain that really needs to work at 100% shuts down. So it's very, very tough for them. The facts, many people with ADD never outgrow it. Their symptoms can continue their whole lives. And at least half the children with ADD will continue to have troubling symptoms into adulthood. More facts, stimulant medications, Vyvanse, Adderall, Concerta, and others, although they are sometimes abused, are among really the safest and most effective medications we have. And more than stimulants are needed. Education, support, exercise, nutrition, coaching, school work strategies, and other things are helpful, important, and really essential to get somebody to function as well as they can. Key points, treatment does not make somebody with ADD a different person. Rather, it removes the barriers that hinder them from being the kind of people they could be. And another key point, and this work really comes from Amen Clinics, there are at least 6 different types of ADD, and the treatment of each type varies depending on the subtype. So you need to understand the subtype to optimize the treatment. You can't give the same treatment to every single person who has ADD. Causes of ADD, that's supposed to be a DNA double helix, representing genetics, of course. And a recent study in The Lancet, which is a prominent medical journal in the United Kingdom, showed that children with ADD have more significant genetic issues than children without ADD. And it's very common when we evaluate people with ADD that we find that one or both parents have ADD. There are higher rates of ADD in adopted children. And today's New York Times, for example, has an article entitled Growing Up Digital, Wired for Distraction. And in the article, they talk about the younger generation growing up, that they're texting, they have phones, they have iPads, they have Facebook. And, one wonders, what is the impact on a developing brain of growing up with that kind of technology? And I think most of us fear that many of these younger people will have difficulty being able to sit calmly, to regulate themselves, to stick with something, stick with a book, wrestle with it a little bit, rather than a quick electronic fix. Causes of ADD. Some people with ADD have what we would call a developmental lag. That is, in a sense, they don't have a fundamental problem, but their development is slower than that of their age peers. We see something similar when we look at puberty in young girls. We know that some girls start puberty at age 7, others would start at 17, and you could probably plot the ages along a bell curve for all of them. And we think that a similar thing may happen, that with some people with ADD, their development lags behind. Prenatal nutrient deficiency, we find that there are low levels of folate and omega-3 fatty acids during pregnancy, and that sometimes they can be associated with childhood ADD. Secondhand smoke is thought to be a culprit. None of these causes are exclusive. Probably one needs several of them. Oxygen deprivation in utero during delivery, brain infections, meningitis, which is a serious bacterial or viral infection that can occur early in life and later on, in fact, but early in life, and there can be significant sequelae or residual problems from that. Lyme disease is something that we think is epidemic, and although I'm not aware of any studies that look at the relationship between Lyme disease and ADD, my suspicion is that we'll see a connection in the future. Brain trauma is very common. We see it all the time here at Amen Clinics, and especially brain trauma to the left frontal lobe can contribute to or cause ADD. Indoor air pollution. I ran across a study recently that suggested that children raised in homes with gas appliances may be at an increased risk for ADD because of nitrogen dioxide, a pollutant that's generated when gas is combusted. Heavy metals. Excuse me a second. Heavy metals. We live in a sea of chemicals, of toxins, and mercury is all around us, lead is all around us, arsenic is all around us, aluminum, cadmium, and we do believe that exposure to these heavy metals can contribute to ADD and other negative effects on brain functioning. Let's see here. Other causes of ADD: enlarged tonsils. There is some thought that one of the reasons for the apparent increase of ADD recently is that we've stopped taking out tonsils in young kids. And as somebody who had his tonsils out at 2.5, I might have liked not having them out at that age. But we do wonder whether all those puffy tonsils are blocking airways, contributing to sleep apnea and causing problems. Pesticides, we do think that exposure to significant pesticides during pregnancy and later on is associated with increased childhood ADD. Buy organic fruits, wash thoroughly. Other causes: excessive exposure to manganese, which is a metal. You can get it by the way, that's not magnesium, it's manganese. Sounds like magnesium. You can get it in drinking water. And it was in infant soy formulas 15, 20 years ago in very high concentrations. And my understanding is that the concentrations of manganese nowadays, the concentrations are far lower, but it can cause a problem. Inflammation. Inflammation is something that's very significant, and we often do a test called the cytokine stimulation test to look at inflammation. Inflammation may be a final common pathway of many psychiatric conditions, but especially ADD. Western diets, children who eat a Western style diet with sugary, processed, fried foods, fast foods, far more likely than those who eat a healthier diet, a non-Western diet, fruits, vegetables, whole grains, etc. And one has to wonder, is it the diet, or is it that children with ADD make poor choices? Maybe both. Picture there, candy. So we're trying to imply that a lot of sweets, food colorings, not a good thing. Food colorings and additives and preservatives. Sometimes reducing those things from the diet can make a profound positive impact. Not all the time. And I commented here that Europe is more advanced than the United States. Europe mandates warning labels on a number of foods that contain artificial colors to warn that these foods can have a negative impact on attention and hyperactivity in children. A couple other points here, maybe then we might pause and take a few questions. Food sensitivities and food allergies. We find many kids and adults with ADD have sensitivity to casein, which is found in dairy products, the dairy protein gluten, which is found in grains, yeast, many others. And we've been doing a lot of food sensitivity testing, which has been quite helpful. And there are studies that show that low levels of zinc and copper and iron are associated with the increased risk of ADD in children. Let's see here. Causes of ADD. She doesn't like her veggies. Kids don't like green stuff. And here's a book, which is a pretty good book. They Are What You Feed Them. I like the title. So let's just see here. Okay, maybe we can pause. David, if we have any questions, maybe you could send them to me now, and we might pause here a bit to take some questions and then resume in a moment. Oh, okay. Here we go. Will a copy of the PowerPoint presentation or handouts be available to print off? Mother, who is 81, now has ADD. She has lost all of her short-term memory. Is there anything that can be done to help her enjoy her last days? What's the relationship like with between ADD and OCD? I can certainly make the slides available to Dave. In fact, David and Sherry already have the slides, and certainly it's fine with me if you would like to make them available for people to print off. I understand also we'll be able to look at a replay of this presentation. Is there anything that can be done to help Mother? It depends how far along she is with her memory deterioration, but sometimes stimulants can help boost the front of the brain. There are memory medications, diet, exercise if she's able to do that. There are supplements that can boost the brain, ginkgo, phosphatidylserine, L-tyrosine. So maybe I'll pause there. What is the relationship between ADD and OCD? My son has been showing signs of OCD. We think of them as independent conditions, but it is quite common to see OCD in somebody with ADD. And the reason is that the front of the brain, the primary problem with ADD is the prefrontal cortex, and when that doesn't function well, one does not have a good capacity to self-regulate. So other parts of the brain, more primitive parts like the anterior cingulate, the basal ganglia, they start in an unhealthy loop and you get OCD symptoms. Let's see here. Is there a connection between ADD and delayed? I can't quite make that up. Delayed something. I am concerned about the effects of the radioactive isotope that is used for SPECT. Can you elaborate levels, other tests? Oh, and husband concerned about cancer. If you have a SPECT exam, you are exposed to a small amount of radioactive isotope. It's about the third of the amount of radioactivity that you would get if you had an abdominal CT scan for constipation. So it's a small amount. We do not think that that small amount causes cancer. It's probably better to avoid all radiation if you can do it, although there's some data to suggest that very small exposure to very small amounts of radiation actually has a health promoting effect, but I think that's being researched at this point. At any rate, why don't we go on? And so I'm going to talk a little bit at this point about the SPECT imaging that we do. And here's a slide, how do you know unless you look, which is one of the catchphrases we have here at Amen Clinics. Because for so many years in my field in psychiatry, we've been treating the brain without really having much of an idea what the heck is going on inside the skull. So how do you know unless you look? Let's see here. Imaging the brain. SPECT, single photon emission computed tomography. We look at blood flow. We look at brain activity. We're really interested in brain activity and the different areas of the brain. And for about 20 years or so, during the past 20 years, we've done about 57,000 studies. So quite a few. SPECT is not unpleasant at all to go through. And the results show you three fundamental things: areas that work well, areas of the brain that don't work well enough or hard enough, and areas that work too hard. And here we're going to show some information about the 6 types of ADD. The first type, and let me see here, I think I can, yeah. First type here, this is classic ADD. It's a combination of hyperactive, impulsive, and inattentive ADD. Second type is inattentive, that is, you don't have the hyperactivity, you just have attention issues. Over-focused is type number 3, and this is where you might see somebody with OCD. You can have over-focus symptoms, you can have ADD symptoms as well. Number 4, temporal lobe ADD. Often they will have temporal lobe issues, temporal lobe trauma, negativity, anger, broodiness, irritability, and ADD symptoms. And this is one of the instances in which if you did a one-size-fits-all, if you give somebody with temporal lobe ADD just a stimulant without stabilizing the temporal lobes, you're really going to run into problems. This is limbic ADD, ADD with some mood issues, and then type 6 is ring of fire. And ring of fire we see most often in kids and sometimes in teens, occasionally in adults, and it's a remarkable amount of overactivity in the brain, remarkable amount of overactivity. And ring of fire cases, if you give them a stimulant without cooling down that overactivity, you're going to have some trouble. Criteria common to all types: short attention, distractibility, organizational problems, follow through, poor internal supervision, short attention span for routine tasks. When they have something that they're interested in, they can hyperfocus. It's not uncommon for parents to come in and say, well, he can't have ADD because he can sit in front of the video game for hours on end. Well, that's pretty typical. Other people feel somebody with ADD often doesn't listen. Short attention span, here again, they often need activities that stimulate adrenaline. In fact, we talk about adrenaline deficit disorder, and here you can see that 4x4 doing some crazy stunts. Distractibility. People with distractibility with ADD tend to hear, they experience the world more powerfully in a way. They hear, they smell, they feel, they touch, hypersensitive to stimuli, noises, sounds. Kids with ADD like this are often sensitive to tags, clothing. Things have to feel just right. People with ADD commonly are disorganized, frequently late, they procrastinate, their personal or workspace is often a mess, they have piles, many unfinished projects, many conversations going on in their mind. It's as if their mind is disorganized as well. Example of clutter. And they tend not to follow through. They have multiple interests. They will do a project only as long as they have a pretty significant interest, and when their interest dies off, so does their investment in the project. Often they'll stop. It's not unusual for a wife to come in with her ADD husband and tell me that the bathroom's half undone and he knocked out a wall here and didn't repair it, and et cetera, et cetera, et cetera. Poor internal supervision, long-term goals, difficult. The moment is what matters. They live for the moment. They take a crisis approach to life. They have trouble thinking through the consequences of their behavior. Consequences don't seem to matter. Here's an example, and Daniel Amen writes very nicely about this, about conflict seeking. You will find that some people with ADD like to stir up others. It's probably related to this adrenaline issue that we talked about, that when they stir up others, they get psyched up, their adrenaline pumps up, and they probably feel more alive, awake. Okay. Let's see here. Maybe we'll go through ADD through the lifespan quickly, and then we might pause for a few more questions. First 12 years, these kids who are hyper are really hyper. Often, as babies, they're colicky, hyperactive, sensitive to things. It often goes unrecognized in girls because they are much less often hyperactive. Short attention span, distractibility, handwriting, frequently interrupt, etc. Often sleep problems, bedwetting. The bedwetting speaks to this developmental lag, developmental delay that I mentioned earlier. Sleep problems, it's very common that somebody with ADD will have difficulty with phase transitions. They have difficulty going from wakefulness to sleep and difficulty going from sleep to wakefulness. Adolescence, the hyperactivity tends to die down some. So if they haven't been diagnosed by that point, they may be overlooked. Often impulse control disorders, school underachievement, similar symptoms. Again, lots of sleep issues. It's very common for parents to beg for help to get their ADD kids up in the morning. Often they have school failure, impulse control problems. Reflexively, they have great reflexes, but because the front of the brain isn't well developed, they don't have great judgment. So the accident rate of teenagers is significantly higher than people of other ages. And auto insurance rates begin to drop for teens at about age 25, which is when the prefrontal cortex is fully developed. And the prefrontal cortex is the fundamental problem area for ADD. Adults, job failures, multiple job changes. It's incredible how many different jobs somebody might have in their lives. Frequent moves, driving problems, speeding tickets, excitement seeking, again, sleep problems. And here we go. This is evolution from primates, lower primates, to modern man, and modern man on the right there isn't looking too healthy. So let's see here. Why don't we pause here, and maybe if there were more questions, we can address those. Okay, here is one. What is the false negative rate in SPECT? We never make any diagnosis based solely on the SPECT imaging. SPECT is a very powerful tool, but if you come to Amen Clinic, say, we do the SPECT imaging, you have a very thorough evaluation. We do rating scales, we do checklists, we do for adults, we do a computerized inventory, and then a fairly lengthy meeting with the psychiatrist, and you put all the information together. And it's so I wouldn't say we don't think in terms of false negative rate. No test is perfect. Let's see. Is there similarity with ADD and trauma symptoms? There can be. The prefrontal pole right up here is very commonly damaged, and damage to that area will, if it's significant enough, will give you symptoms of ADD. So as I mentioned earlier, we see lots and lots of brain trauma, and again, it speaks to the issue of how do you know unless you look. Our son would be 11 in 2011. Should we consider brain imaging now or wait until his brain matures a bit? Well, if he's not having any problems, of course I wouldn't have him scanned. But if he's having problems, and I assume he is, which is why you're sending in the question, I would have him evaluated now. The sooner the better. The longer these issues go on, the more school difficulty, social difficulty, problems with self-esteem arise. So the sooner the better. How do you help a 13-year-old girl with organization sleep? It depends, say with organization, it depends what the issues are. If she's got ADD and organizational issues, kind of the multimodal treatment approach that we're talking about today can be helpful. Medication can be helpful. Diet, exercise, nutritional supplements, really a number of things. We often will recommend an ADD coach or tutors to help with schoolwork. Sleep. Try to reduce stimulation at nighttime. If you have to, confiscate the cell phone, the computer. Try to have her have a regular time to bed and time to get up in the morning. Easier said than done. Can be done though. My child seems to have two types of ADD, classic and overfocused. In Dr. Amen's books, he recommends a high protein for one of these and carbs for the other. I don't know which way to go. Well, raises an interesting point. Although in Dr. Amen's books, he talks about 6 discrete kinds of ADD, and we do see them discretely. It's not uncommon that you'll see somebody with 2 different types, or yeah, well, when I say 2 different, a combination of 2 different types or 3 different types. In your case, when you have the overfocus type, and then you have classic type, I would go with the high protein, moderate to low carb diet. I think that would be healthier for him. What is your view on caffeine as a stimulant? Well, caffeine is a stimulant, and it's widely used throughout the world. Of course, many of us begin the day with some kind of stimulant, like caffeine. A little bit of caffeine is not bad, and caffeine often will help people with ADD. The trouble with caffeine is it's a vasoconstrictor and a diuretic. A vasoconstrictor means it shrinks down blood vessels, so you don't get as much blood flow to the brain and other organs. Diuretic means it dehydrates you. So anything that reduces blood flow to the brain and tends to dehydrate you is not so good for the brain. So we will see, and for some reason this is common in construction workers, they'll come in and I'll say how much caffeine do they use, and they'll tell me, well, they drink 4 large Mountain Dews each afternoon at work, and you know that they're probably underestimating. So people can get addicted to caffeine, and it's a roller coaster. You get a high when you have some caffeine, but then you get a crash, which is not so good. Will symptoms of ADHD show up if the patient is on medication? We do like to scan people off on medication if we can, as we say in an ideal world, but we don't live in an ideal world. So it depends what medication. If somebody is taking a stimulant for ADD, the ADD is probably still going to show up, but the findings will be less robust than if the person were off a stimulant. There are other findings that vary with each particular medication, such as serotonin reuptake inhibitors and so forth. Let's see. I think that may be the extent of the. Oh, is TV too stimulating for an ADD child before bed? May well be. It may well be, and it probably would be better to have some kind of calming ritual, soothing ritual, rather than something exciting on TV. Well, let's continue here and talk a little bit more about how to treat ADD. First thing I have down there is protect the brain. No football, and I speak as a former football player. Soccer is a great sport, except for the headers, and we've seen lots of people who've had significant brain trauma due to soccer. Thrill sports, bungee jumping, and doing skateboarding, skiing, snowboarding without a helmet. Parent training can be helpful. That's not to say that the parents are the problem, but helping them think through strategies can be very useful. School interventions can be helpful. IEPs, which are individual education plans for the students. School accommodations can be useful. Talk therapy can be helpful. Some therapy we talk about using to combat ants. Ants is a term that Dr. Amen coined. It stands for automatic negative thoughts. And all of us have a constant stream of automatic negative thoughts that run through our mind. And we shouldn't believe all these darn thoughts. People with ADD, because of the negative experiences they've had in life and the excessive failure and the negative comments they've heard, tend to have more negative thoughts than most people. So talk therapy can be helpful to reframe their development, repair their self-esteem. Neurofeedback can be helpful. Somebody asked about that in an earlier question. I didn't read it. Neurofeedback can be very helpful, and we've found that people can sometimes get off all medication by using neurofeedback. Relaxation training can be helpful to reduce over-arousal. Other points about treatment, assess for medical factors, and I listed here just a few. But thyroid, if your thyroid doesn't work, your body doesn't work, your brain doesn't work. Vitamin D, minerals, zinc, and magnesium and copper, fatty acids. Also look for toxins such as heavy metal toxicity. Look at nutrition, food sensitivities. And I put something there called an elimination diet. My preference nowadays is to do a blood test to look for food sensitivities, but it is possible to identify food sensitivities by doing something called an elimination diet. It's important to be educated about the condition, both for the patient and family, support patient, support family. Supplements can be very important and helpful. Multiple vitamins are helpful. Fish oil, we love our fish oil here. And there are many other specific nutritional supplements that one can use to optimize brain function. Medication can be important, and I'll say a little bit more about that in a bit. Lifestyle change can be very important. Improve the diet, get better exercise, get more exercise, get some exercise. So, effectively treating ADD, limit video games. Somebody was asking earlier about video games. We're especially concerned about video games with violence. We think that it's overstimulated. They're overstimulating. They desensitize people to violence, kids to violence. And even video games that aren't violent, they seem to be addicting and not such a healthy thing. ADD medication choice. As we've been emphasizing earlier, the choice of medication depends on the type of ADD. We'll commonly use stimulants, and stimulants boost the front of the brain. They tend to boost dopamine and increase functioning in the front of the brain. These are things like Vyvanse, Adderall, Concerta. We can use other medications that are stimulating, which do similar things. Wellbutrin is one, Provigil, Nuvigil, or sleep medications. And then also, depending on what other type of, what type of ADD we can use. Sometimes we use medications for anxiety. Often we'll use the anticonvulsant mood stabilizers for anxiety rather than an anxiety medication per se. If somebody has significant depression, of course, we'll consider antidepressants. Antipsychotics, these are medications that were introduced to treat schizophrenia and other related conditions. And people with ADD are not psychotic, but we find that these medications in low dose can often be helpful. We use some blood pressure medications, interestingly, to reduce arousal. 10X and Tuniv, clonidine. So, number of options we have. Dark side of ADD. Fundamental problem really is the lifelong impairment of what we call executive or brain management functions. There's really a mismatch between the brain and the demands of the world. And these have to do with things like focus, attention, organization, judgment, impulse control, excuse me, working memory, and so forth. More about negative outcomes with ADD. Much higher incidence of anxiety, depression, bipolar disorder. Did you know, for example, that virtually everybody who qualifies for a bipolar diagnosis would also qualify for an ADD diagnosis? So it's a very rough rule of thumb. Everybody who has a bipolar label is also ADD, but not the converse. These labels have limits, obviously. Panic disorder is much more common because, again, of the difficulty with self-regulation. OCD, more common. Learning disabilities, substance abuse, significantly increased. Antisocial behaviors, somewhat increased. Suicide, more common than you would think. And with ADD, you see, again, increases in impulsivity, failure, loss, job loss, mood, losing relationships, marriages, relationships with children, social alienation, family alienation, divorce, schoolwork problems, etc., financial trouble. It's not uncommon for somebody with ADD not to file their tax returns, and they only do it 3 years later when the IRS is ready to garnish wages. Physical, sexual, emotional abuse, more common. People with ADD often make poor choices, as I think is apparent. Obesity and hypertension are increased. There was a study last month in the International Journal of Obesity that showed an association between ADD and obesity, and also ADD and hypertension. And in fact, Daniel Amen and the rest of us at Amen Clinics are really looking at weight issues, obesity, and we're finding a significant proportion of these patients who have trouble controlling their weight have lower prefrontal cortex functioning, really ADD. How do you find help? Educate yourself. Take charge of your care. I love it when patients come in or families come in and they have many direct, sincere questions, because that means that they're going to be the coach of the team. They're going to be in charge of the treatment. The doctors recommend, the doctors advise, but doctors aren't perfect. Nobody's perfect. Clinicians aren't perfect, and it's important for all of us, whether it's ADD or anything else, to become as educated as we can, so we're in a good position to make the choices we need to make. If things aren't going well with your treatment, talk with your doctor. Sometimes you can sit down and have a heart-to-heart, and can get back on the same wavelength. Sometimes you need to change a doctor. Sometimes the match isn't good, or the doctor doesn't believe in ADD. We hear that, amazingly. Psychiatrists often have more expertise than other doctors, but not all the time. We find that many family physicians, primary care doctors, internists, and especially pediatricians have good experience, and many times they can help you. Follow through with recommendations. Often people with ADD get a good evaluation, either with us or with somebody else, and then they don't follow through. And getting a good evaluation and not following through is like having a great recipe book. But if it just sits on the shelf and you don't do anything with it, it doesn't do any good for you. Amen Clinic's evaluation, we see, as I mentioned earlier, lots of people who've not been able to be helped before, and very many times we're able to help them when nobody else could. So if you can't get help locally, think about coming to see us. So never give up, never give up. Healing is possible. This is Healing ADD, the book that Dr. Amen wrote with the 6 subtypes of ADD. Actually, we now talk about 8 subtypes of ADD, the 6 in this book, and then type 7, which comes from trauma, and then type 8, which comes from cerebellar issues. The cerebellum, in many ways, is kind of an undiscovered continent in the brain, and we're finding that the cerebellar issues are very important. And last slide here, these are the 4 Amen Clinic locations: Reston, Virginia, where I am today, Fairfield and Newport Beach, California, Bellevue, Washington, and there may be more clinic locations in the near future, so I would say stay tuned. So that's what I have to say, and let me go back to the questions and see if hopefully poor David's fingers won't fall off. Let's see here. Is Strattera an effective medication? If so, for what type of ADD? Strattera can be effective for some patients. In my experience, mostly the inattentive subtype or type 2, according to Dr. Amen's classification. I'll be honest with you, though, Strattera, it's been disappointing. I remember when it was introduced about 15 years ago, and they introduced it, they rolled it out. You thought it was the best thing since sliced bread. And we all were very excited because we thought, here's something to help people with ADD. And you can get refills, you can call it in, but it's frankly, it's not been as useful as we would like. Can stimulant medications cause atrial fibrillation? I would say probably not cause, but if you've got some potential for atrial fibrillation or for for tachycardia in general, you will find sometimes that stimulants will bring that out. We will. When we're discussing with somebody whether they might try a stimulant, we are careful to explore their own cardiac history and the cardiac history of any first-degree relative. So we explore what's the patient's cardiac history, and then what about their parents and siblings. If somebody has some cardiac issues, or say, the patient seems fine, but father died at 50 of a heart attack, before I gave somebody stimulants, I would say, well, let's have you go get an EKG just to make sure. Let's see here. Can a child have both ADHD and Asperger's syndrome? Yes, and in fact, that's not uncommon at all. I do see patients sometimes who come in with the label of Asperger's, and after careful evaluation, we conclude that they're really not Asperger's, or they're not autistic, but what they have is a rather severe case of untreated ADD. And often when you treat the ADD, you find that what had seemed to be Asperger's symptoms go away. Let's see here. What does fish oil do to the ADD brain? Well, we recommend fish oil for everybody, absolutely everybody, except if you have hemophilia or another bleeding condition, or if your doctor put you on something like Coumadin to prevent blood clotting. Even then, I think I'd recommend that you use fish oil, but be a little more careful because fish oil prolongs bleeding time. Fish oil contains omega-3 fatty acids, which we need to build nerve cell membranes, and the human body can't make omega-3s. So we need to get them either in the diet or through supplements. And we find that fish oil in and of itself, apart from everything else, fish oil reduces symptoms of impulsive and inattentive ADD, reduces ring of fire ADD, calms the brain, reduces irritability, reduces mood swings. And we've had some remarkable benefits to our patients with fish oil. My wife is a nurse who runs a local outpatient surgery unit, and her colleagues know what I do, and they often will ask her, hey, ask Joe, what's one good thing that I can do to help my brain? And without missing a beat, I always say fish oil, fish oil, fish oil. So take your fish oil. What is your take on ADD in babies? Probably is there. Obviously, babies can't talk to us, and we don't scan anybody here at AMA Clinics younger than 3. It's you wouldn't want to give an infant a stimulant either, or other powerful medications, unless you absolutely couldn't avoid it. So looking back, ADD is probably there in infants. I know some mothers who tell me that their hyperactive, impulsive child was hyperactive in the womb, so probably there. Let's see here. What effect does excessive video games, TV, have on a child with ring of fire or ADD? Ring of fire, it's not a monolith. There is some variation, but in general, a child with a ring of fire is already overstimulated. Some of them who are a little bit older and who are quite good with words tell me that it's like having 5 different radios playing in your head at the same time, each one playing a different station. So video games are quite stimulating. Television is quite stimulating. So we think that it ups the ante for stimulation, and probably it's not so good. What are some strategies elementary schools can use in supporting students with ADD? What strategies? Well, again, it depends on what the particular needs are for that individual. You could use preferential seating. You could try to reduce the burden of work. Some teachers will, instead of assigning math problems number 1 through 32, they might say problems 1 through 32, but only the odd ones for somebody with ADD. Preferential seating for exams, seating in a testing in a separate quiet room without distractions. Copies of teacher notes, weekly progress reports to parents. Really, it's the things one can do kind of endless. Let's see here. What do you feel about Intuitive? essentially a long-acting guanfacine, which is a blood pressure medication. I have seen it work, and we think it probably does not work quite as well as the regular stimulants like Vyvanse and Adderall and Concerta, but it can be quite helpful. It's a once-a-day medication. You can give refills. You can call it into the pharmacy. And curiously, even though you give it in the morning, it seems to help these patients sleep better at night. So interesting there. Let's see here. Can a child really outgrow ADD? He's 16 now and seems to have really mellowed. We do think that some children will outgrow ADD. And I think the kids who will outgrow it are the ones who have more of a developmental lag. That is, they may not have a fundamental problem, but their development is slow in some ways. Child 16, he really seems to have mellowed. Now, it may well be that if he had been hyperactive and impulsive when he was younger, that kind of stuff tends to dampen down as somebody gets older. But what you often find if you try to tease symptoms apart a bit is that the hyperactivity, impulsivity becomes internalized, and sort of that's the way their mind works, but they're not literally jumping up and down out of the chair. Let's see here. Do you find correlation between food allergy children and ADD? Yes, definitely yes. In fact, I do food allergy testing, I would say virtually 100% of kids, teens, and adults with ADD, and many people without ADD. We have had some miraculous responses to identifying gluten or casein and removing that from the diet. Just incredible. Not in everybody, not even in most people, but you see this once or twice and it sure sticks with you. Why people are ending up more sensitive to gluten is a separate topic that is fascinating. Before I learned much about this, I had assumed that mankind had been eating wheat and other grains for years. And there are various ethnic groups that really have not been doing that have only adapted to eating these grains in the past few hundred years. And we've developed super grains that are really loaded with gluten, so people are exposed to much more. Let's see here. Let's see. Do you believe that a person should have a separate psychiatrist and a psychologist? Yeah, maybe. I am older at this point in my career than many people, many psychiatrists fresh out of training, and I did my training during the era where we were taught to do psychotherapy, expected to do it, and we came to appreciate the power and the joy in it and doing it. Unfortunately, many young psychiatrists have not had much psychotherapy training, and then there's insurance pressure to do quick medication checks because it's more lucrative. So it probably would be helpful in a number of cases to have a psychiatrist who would monitor medication and so forth, and then to have a psychologist or other non-medical therapist. However, if you can do one-stop shopping, if you can find a psychiatrist who also can do talking therapy and likes to do it, I think that's the ideal, but you don't always get it. Let's see here. When is brain imaging recommended to diagnose? In what I would call simpler cases of ADD, you don't necessarily need brain imaging. I would say do brain imaging if you try reasonable things like you have an evaluation, doctor says this is a garden variety ADD, and you use a stimulant and the patient has a very difficult reaction to it. So okay, maybe they had a funny reaction to that stimulant, try another one, same thing. So when you're not getting a good response to what would seem to be reasonable things, I would say get an evaluation with the brain SPECT imaging. It allows us to subtype the various types of ADD. We can customize treatment better. We can look for brain trauma. We're in a better position to look for toxicity. So it really is helpful. It really is helpful to have that. Does insurance cover it? Insurance generally will not cover ADD, will not cover SPECT scanning for ADD, sort of pure ADD alone. But we often do find that patients with ADD will have other issues such as significant brain trauma, temporal lobe dysfunction, sometimes even seizure issues. And so insurance will often reimburse part or the chunk of these fees for the SPECT scans if you have those other conditions. Let's see here. Can a fall as a young child that caused unconsciousness damage the frontal lobe in a way that would cause lifetime problems or ADD? Yes. Yes. What are some easier and effective ways to boost dopamine levels? You can take nutritional supplements, and again, I guess I'll mention some things, and we always give a caveat, discuss this with your doctor. L-tyrosine is an over-the-counter nutritional supplement that is converted into dopamine, so that will boost dopamine. Taking B vitamins will increase methylation and boost dopamine and other neurotransmitters. Taking SAMe, S-A-M-E, S-adenosylmethionine, will also boost the dopamine, boost energy. Pycnogenol is another nutritional supplement which can do it. Okay, let's see here. Isn't it true that low dopamine levels and other neurotransmitters are associated with ADD? Yes. And again, with the caveat that there are different subtypes, but in general, for most of the patients we see, they do have low dopamine. But many of them also have other things going on. Let's see here. David just sent me a question. He said, well, I could keep on going. I will keep on going for a little bit. He said there are 400 questions, so obviously poor David's fingers couldn't type them all. Any clinics that take the Amen Clinic approach in Canada? Amen Clinic approach brain imaging. There are not. Well, there. I know Dr. Amen spoke at the inauguration of a new clinic or a new service in the western part of Canada. I believe it's in the Vancouver area. And I don't know exactly what they do, but I believe that they're doing brain SPECT imaging. As for are there Amen clinics in Canada, no. We do see a lot of people from Canada. I see a lot of people myself, and in the Bellevue, Washington clinic, which is quite close to the Canadian border, they see a lot. Can ADD worsen in postmenopausal women? Yes. With menopause and afterward, what you have, this is really boils it down, but what you have is a decline in estrogen levels. Estrogen is a monoamine oxidase inhibitor, MAO inhibitor. And so by inhibiting that enzyme, you tend to have around higher levels of dopamine and norepinephrine and some other neurotransmitters that I won't go into. When estrogen levels drop off, that enzyme is not inhibited, which means it really starts to work at chewing up the neurotransmitters. So you're probably going to have less dopamine around. Menopause, postmenopause, very interesting, complicated issue. So I don't think I've done it quite justice, but the short answer would be yes. Let's see here. I want to see if we have any other questions that I might address. Oh, here's one. Let's see. Yeah. How do you locate a clinic in a particular area to have the scanning done? Well, not to toot our own horn, but I do think we're the best. We have one clinic on the East Coast right now, 3 on the West Coast. So in part, it depends on where would you like to travel to if we're not near where you are. Do you have friends? Do you have relatives? Did you go to school in Washington and you'd like to come to Reston and get an evaluation and pay a visit to the old campus. So let's see here. How do you any relationship to ADD and Alzheimer's? There's no formal relationship that I am aware of. However, we do think that anything that puts stress on the brain or damages the brain can increase the risk for Alzheimer's. For example, people with ADD have a higher rate of substance abuse, and if they have more, excuse me, if they have more substance abuse, that damages the brain and indirectly could contribute to Alzheimer's. If they're daredevils, they're going to have more brain trauma, same thing. Smoking, obesity, hypertension, all of these things increase the risk for Alzheimer's. Let's see here. What type of doctor should one see? Well, somebody has a question about Gerstmann syndrome, which pretty, I wouldn't say out there, it's an actual neurological condition. Gerstmann syndrome, ADD and absence seizures. I would probably consult a neurologist, but depending on what the neurologist finds, I think it might not be a bad idea to come to one of the imaging clinics and get the imaging. Let's see here. Oh, what is the name of the medication you mentioned that is taken in the morning and that acts as a stimulant but also shows some help with sleep in the evening? It's Intuniv, I-N-T-U-N-I-V. Intuniv is made or marketed by Shire Pharmaceuticals. And Intuniv was originally marketed for ADD patients who really kids and teens with oppositional defiant features. And in fact, it may have, may be especially beneficial for those kids. And this shows you how marketing and pharmaceutical companies, how they look at this. Even though they thought they had found a niche, and I think they had, they found that doctors weren't prescribing it for ADD kids who were not oppositional. So they totally removed that aspect of their marketing. So at any rate, Intuniv. Intuniv is essentially long-acting Tenex, T-E-N-E-X. And what Shire did was they took Tenex and they made it a bit longer acting. But we've been using Tenex for quite a while. Okay, well, I think maybe a couple other questions here. I see, let's see here. What can you take as a supplement if you were allergic to fish oil? You know, I've had this question about 4 or 5 times in the past 2-3 weeks, and it hasn't come up in the past few years, so I don't know what it is. But if you're absolutely allergic to fish, I would take flaxseed oil. However, I have learned about several fish oil products that really are not fish oil per se. That is, they don't come from fish; they come from algae. So if you Google fish oil algae or omega-3s algae, you'll be able to find several products that come from algae. And how fish get it, you have a little fish that eats the algae, bigger fish eats the little fish, much bigger fish eats the bigger fish, etc. And so the fish that we tend to harvest to get the fish oil are pretty big, you know, tuna and salmon and so forth. But it's a cascade, so it comes from algae. There's a question, is flaxseed oil just as effective? Flaxseed, no. The only, really, I'll go for flaxseed in a patient if they're a strict vegan, that is, they will not consume or use any animal product. In that case, flaxseed is better than nothing. But the trouble is that your body has to convert the components in flaxseed oil to the kind of the omega-3s that we find in fish oil. And the conversion is very inefficient. And you probably have to take 10 times as much or more flaxseed as you would regular fish oil. So unless you have a moral issue or unless you have a true allergy. I saw somebody last week who had a food allergy, a fish allergy, And I did recommend that they get some Benadryl and an EpiPen and so forth, and try a little bit of the omega-3 that comes from algae, because I think that it's so much better than the omega-3 that you get from flaxseed. Well, it's about quarter after where I am, and I think my voice is going, so I will pause here. It's been a delight. It's fun talking about these things. There are obviously many questions coming through that we can't touch on. I think I'm going to do at least one more of these, maybe focusing more on treatment, or maybe we'll look at the questions and see what some of the common themes are. And it makes me feel good to know that we're here at Amen Clinics to help people who are having difficulty finding help out there. And it's also sad as well. But I'm glad we're here. Thank you for tuning in. It's been a pleasure, and look forward to seeing you again soon. Take care.
Well, thank you very, very much, Dr. Annibali. Joe, this has been fantastic. And folks, thank you so much for joining us. I just do want to say this before we close. This presentation specifically has been sponsored by Amen Clinics, like you know. And they are making an offer available. And I have it right here. It's the third from the left. And I have the whole package right here. Pretty good stuff, I have to tell you. Let's start with the first one. Natural Ways to Heal the Brain. It's right there. There's a 5 CD set. Treat ADD, anxiety, depression, memory problems, and insomnia. 5 CD set. There's a DVD set. I think actually Dr. Amen is actually in a live audience meeting, so this was recorded there. And Magnificent Mind with Medical Hypnosis. That should be good. And of course, the book, Magnificent Mind at Any Age by Dr. Daniel Amen. By the way, he's coming up with another book next year. I think it's called the Amen Solution, but some really good stuff coming out of the Amen Clinics. And of course, there's a master questionnaire, Magnificent Mind at Any Age. Folks, this, like we mentioned at the beginning, this is just the start. One session just can't do enough justice. So we really want to encourage you. Many of you have the links. If you want to look into this some more, just email us. You can click on the banner above my video, and that takes you to our site. And I believe this series or this package is going at a discount. So if you want to take it, this is only going to be available for those of you who are registered and who have watched this presentation. All right, commercial over. Oh yes, we do have our own presentations. We've been collecting presentations on autism, brain health, children's brain health, and education, and we've got some fascinating speakers. Not all as good as Dr. Annibali, but we've got some that hold their own as well. So I want to really encourage you to take advantage of these resources. Remember, health is a lifelong journey. There are no quick fixes, and so you've got to commit to learning and to growing, and I think that's what most of you out there are doing. Sorry we couldn't cover all your questions. Please send them the questions. Click on Dr. Joe's banner. Hang on, let me show that to you really quickly so you can see what we're talking about. Right there. So you're going to go to his site, to our sites. Again, click on the banner above me. Click on that banner right there. There, bingo, right here. Click on that banner. Once you do that, you're going to go right to the blog or the comment section. And you can see that he has already answered quite a few, and his answers are in the red ink. So bold red ink. So you can go there, type in your questions, and that will help him know how better to address or to map out his next presentation. So that will be really good. And I see that. Okay, someone says, thank you, I bought those products last night. Did not realize I would get a discount. Well, that is the discount. I think it's a lot more expensive. Any talks on dementia in old age? Well, we do have some presentations on dementia in old age by a wonderful lady called Vicky Surash. As a matter of fact, if you look for her on our website, she talked about normal aging, showed all the systems on what you should expect with normal aging, and then she now talked about dealing with Alzheimer's disease. And what I particularly like about her is that she talks about it both from the medical perspective and from a caregiver's perspective. She's a gerontologist by profession, but she goes right down into the nitty gritty, the minutia, what we would call minutia, from everything from taking care of the elderly to bedpans to all the other stuff that we don't want to think about, but are very, very important as well. So she has done a few. I think that will actually be available in recording. All right, someone says, excellent talk and speaker. Okay, well, sorry, Kay, I didn't get your question. All right, I think we've kept you guys up long enough. Send your questions to us, email us if you have any more questions, or call us. We are here to serve you and really to help you. Yes, slides. Thank you for reminding me about that, Paula. We will put a link on our homepage with the slides, not the slides themselves. Don't get me wrong. We'll create a handout and then of the slides, so you can go to our homepage. It's probably going to be below the banner. Click on that, and then you should be able to download it. Probably not right now, but before the day is over, we should have it ready. So thank you for joining us. I'm glad you enjoyed it. Okay, great. Thank you. Yes, I hope we do many of these as well. Dr. Annibali will hopefully be doing one before Christmas. So take care. God bless. Bye.